All right, my name is Daniel Chege. I am a family nurse practitioner here at Alive and Well in Dallas. And I'm going to talk today about the longevity 3.0 that we are going to be having at Alive and Well. But a little bit on my background, I am a family nurse practitioner. I was trained through the Western modern medicine route as everyone else usually is. And I was certified as a family nurse practitioner. So I ended up going into family medicine. And it's through going through family medicine that I realized that my patients were not getting any better, and they were coming back to me for the symptoms from the side effects of medications that I'd given them before. And I, I was starting to get curious as to what exactly I was doing in the realm of medicine and felt a little cheated with how my training was. So it led me to dig a little bit deeper to find out what would help my patients. And that's when I came upon functional medicine, which is more towards the root cause of issues. And I really loved it. It mushed with my personality, it mushed with what I thought medicine was about. And I have been practicing functional medicine for about 6 years now, and it's been great. And one of my passions, which led me into going into this, was because I'm very passionate about metabolic health, because I have had to treat a lot of my family for metabolic health, plus myself. So it has been one of my passions to help people with their metabolic health. And as we know, diabetes and high cholesterol, heart attacks, or cardiovascular issues, that has been a big problem that we've been seeing here in the last few decades rise. And I want to talk a little bit more about the longevity piece of it, which we can differentiate between lifespan and health span, where we can talk about how long somebody lives, but also we need to consider the fact that even in that length of life that they're having, how much quality of life are they having? And that's where health span comes in. And the way I would propose that you look at it is you have two paths. One is the wellness path, and the other one is the illness path. And you want to be staying around the wellness path throughout your life. So you're keeping your quality of life good, your functionality is great, you're enjoying life, as opposed to being closer to the illness path, which you can still be alive, you still have the lifespan, but you're not really enjoying life. You may be bedridden, you may be using medical devices which you otherwise would not be using if you were staying well, which would limit your movement, would limit how much you can be able to enjoy life. So the longevity program that we have is more towards keeping you on that wellness path and helping you by educating you about your body as to how you can stay on that wellness path. So we are doing quite a bit of testing to be able to help you be able to have a clear picture as to what your body is saying. And we're giving your body a language to communicate to you as to what you should be able to do to help it be able to stay at a wellness path, to be able to help you enjoy life. And I'll just kind of give you a good broad overview of what we're going to be doing. And it'll just kind of give you a snippet of what the things that we're looking at and how they're going to help give you a good idea as to how your body can be able to stay in balance. So so we have them divided into about 7 categories, and the first category is cardiovascular testing, and we are coupling a few things. One, we are coupling blood work, and blood work here will be the lipid profiles, and we're also looking at inflammatory markers, which would end up causing cardiovascular disease, because just lipid profiles by themselves usually don't give you enough information. And then we are also checking to see if you have any plaque formation in your arteries with a test called Clearly. And it's usually a combination of a CT scan of your arteries plus a little bit of artificial intelligence to help you be able to see what plaque you're having in your arteries. That helps us a lot to see if we need to start reversing plaque formation, or if you don't have any plaque formation, we can prevent it. And then we also have vitals, things like just checking your blood pressure, checking your heart rate variability, and also genetic testing, which will help us to know like what's predisposing you towards cardiovascular disease and how can we bypass that. The second category is metabolic testing, and it's mostly geared towards looking at how your metabolism works, where we check your insulin, we check your glucose, we can also check your basic metabolic rate with a machine called a PNOE. We also do check to see what your VO2 max is. That will help us to know a little bit about metabolic and a little bit about cardiovascular health. Thus, it'll clue us in as to what we need to adjust to be able to, again, keep you on that wellness path. And then we also do an in-body measurement, which usually checks your body composition, checks your skeletal muscle, checks your body fat. That's usually a really good monitoring tool to be able to see your progress, especially whenever you start, and then when we make changes and where you continue to go as we continue to make those changes. And then going to the third category, which is what we call the micronutrient check or the vitamins and minerals check. We will be doing blood work, which would be checking things like iron, things like zinc, copper, we're checking vitamin Bs and vitamin Ds, but we'll also be doing another test called the Metabolomix, which checks your urine for metabolites for things like B vitamins. It also checks to see where your amino acid status is. So it's going to tell us how much of your amino acid profile or protein profile is. Are you eating enough protein? Things like those. And then the fourth category is hormone testing, and we will be checking your thyroid. We're checking your sex hormones. We're also checking your adrenals to see, and they work very much together. So we're also checking for balance between all those to see what we need to adjust so we can be able to, again, get you back to balance. And then the fifth category is cellular health. I'm combining that with like toxins and inflammation. So we're kind of just seeing what your cells are doing. How are they detoxing? How are they handling inflammation? And with that, we usually check your TELO test. And the TELO test is checking your telomere length, which usually gives us a good idea as to how your cellular health is and how their lifespan is. How do they cope with stress? Things like those. Which is a buccal swab test. And then there is liver function tests, which is blood work, which we're just checking to see how your liver is functioning. Is it straining? Does it need some help? And if it's functioning properly, how can we be able to optimize its functionality? And then there's also inflammatory tests, which can be blood work and also can be through the Metabolomix. And we also check oxidative stress markers. So things like ox-LDL, we are checking to see where your omega-3 status is, because omega-3 is a very good anti-inflammatory, wanting to see if you have enough. And it's one of the common deficiencies that I see. And then another thing that we check is your toxin level. And we kind of do mostly a screening of heavy metals to see if there's like mercury, lead, arsenic, things like those. And this is mostly a screening to see if there's any in the blood, because most of the heavy metals are usually in your cells. So if there is some in your blood, it may prompt us to do a deeper dive. And then the sixth category is immune health. And we just wanted to see where your immune system is. And the immune system works as a balance. So we're checking to see if there's anything that's causing your immune system to be imbalanced. So we'll be checking some blood work, things like the complete blood count. We're checking an ANA, which usually tells us if your immune system is fighting itself. We also are checking a test called a Galleri test, which is checking to see if there's any susceptibility to cancer, because it checks for cancer proteins. So it's able to tell us way before you can be diagnosed through normal ways of diagnosis. And then we also would be checking a test called a GI map, which is a gut test, and 75 to 80% of your immune system is in your gut. So whenever we do check your gut, it gives us a really good indicator as to what your immune system is doing. Okay, the seventh category is genetics. And I mentioned genetics briefly when we were talking about cardiovascular issues, but we're going deeper into seeing what genetics, how you respond to the things outside, and how we can be able to help you bypass the things that you don't respond very well to. So MTHFR is one of the biggest ones that we know, which is going to tell you if you're able to convert folic acid to folate, and folate you use for methylation, which is how you are able to absorb things in your body. So the test that we do for genetics is called 3x4 genetics, and we like 3x4 because it prioritizes which genetics are really important. So we don't have to like be inundated with too much information and not know how to prioritize it. It shows us which ones are the ones which we need to address really like urgently to be able to get the most effectiveness from that. And that's kind of the summary. I know I talked a lot about each and one of them, but that's the brief summary of the tests that we're doing. And we kind of sit down as providers and see what will be the best way to go about recommending or making the recommendations as to what would make you stay in that wellness path. All right, see a question come in. The difference between biological age and chronological age. How would you approach reversing one's chronological age? Okay. So we also have to go back to find out, okay, so what causes you to age? What is aging? Because we can say it is normal to age because we're getting older, but we also have to consider the fact that some of the things that make us age is malfunction or dysfunction of the things in our body which are supposed to be functioning properly. I'll give you an example, like a mitochondria, for example. Whenever your mitochondria is dysfunctioning, it's inevitably going to cause you to age. And the things that make you not have good functioning mitochondria are out there in the environment. You know, we can talk about toxins, we can talk about the food that we're exposed to, and those things would cause you to start aging a little bit faster if you don't start addressing that. So when it comes to biological age, we're talking about how inside is aging as opposed to how outside you may be thinking you're aging. So chronological is, okay, I am 37 years old. That is what I would say my age is, but inside I may be aging a little bit faster, maybe a little bit slower, depending on how I'm taking care of myself. It kind of goes back to the lifespan versus health span, where the health span, you're looking at the quality. That quality is inside, is how are you taking care of inside to not progress into going away from the wellness path into the illness path, as opposed to lifespan is just looking at the age. It's just very superficial. So it's just looking at a number which you were told when you were born. I don't know if that answers your question there.
With the servo up and running.
Is there any other questions? No questions there? Okay. I think we're good. All right. I hope that information was helpful. Oh, there's some coming through. Hold on. Um, could you speak a little bit more about MTHFR markers? Sure. So MTHFR is a gene that stops you from converting folic acid into folate. It is in the folate cycle, which is part of what we call the methylation cycle. You can have one of those genes turned on and one of those genes turned off, or you can have both of them turned off. Regardless, it is better to bypass it and just use methylfolate, which you don't need to convert into something that you need to use in the body. It's already bioavailable. And whenever you have MTHFR deficiency, or I mean MTHFR mutation, and you are taking folic acid, what tends to happen is that you're not able to detox that folic acid and cause things like anxiety, and it may actually start causing issues for you, like even brain issues, because you are not converting the folic acid. Thus, you're overloading on it, and you can't be able to use it very well. So methylfolate would be the best way to get folate in that case, and then getting into the methylation cycle and then create what we call a methyl donor, which helps you to be able to get things bioavailable. So eating that pineapple, you connect it to a methyl group so you can be able to absorb that pineapple. But if you're not having methylfolate and the methylation cycle is not going, then you're not creating that methyl donor. Thus, you're not able to absorb a lot of the nutrients that you need. And what is the best supplement for mitochondrial health? There's really not one supplement. I always say it depends because it's very individualistic. One big one that I use is ATP 360 by Research Nutritionals, because it has a really good combination of pre and post mitochondrial function. So it helps with not just helping the mitochondria function well, but it's also giving you the raw material to help the mitochondria function well. What else would I use? I use Methylene Blue a lot, Lumental Blue, that's a good one too. Combination of the two has actually worked really well for me, the ATP 360 and the Lumental Blue. All right, I think we're good. I'll thank y'all for participating.